government in inculcating this practice not only for patients but also for the healthy human beings so that they can live a healthy life. And also we are working with the All India Institute of Ayurveda in Goa, and now today only he said that the Government Medical College Goa and AIA, that is the Ayurveda Institute of Goa, will work together in promoting integrative oncology so that our patients can get the best of the thing, modern as well as the traditional Indian knowledge that we have. Over to you, sir.
समाकलन 2.0 इस कॉन्फ्रेंस के लिए मैं खास करके यहाँ पे आया था. मेरे साथ में रेस्ट ऑफ द डॉक्टर बड़वे एंड रेस्ट अदर डॉक्टर्स आर हियर. इट इज ऑर्गेनाइज्ड बाय द आयुष सेंटर ऑफ द एक्सीलेंस. It is an advanced center for the treatment, research and education cancer, Tata Memorial Center, in collaboration with the SARS Center of Ayurveda Research Institute, Mumbai, and supported by the Ministry of the Ayush, Government of India. उन्हें सपोर्ट किया था. इसकी जो थीम थी इसके लिए, which is an experience and evidence in the various aspects of the integration of the TCIM modalities in conventional cancer care, pharmacological Ayush intervention in cancer care, non-pharmacological Ayush intervention in cancer care, digital health AI and innovation in integrative cancer care, in silico vitro vivo based studies जो यहाँ पे कर रहे थे. इस खास करके इस समाकलम 2.0 में the integrated practitioners from the all over the Maharashtra and the different part of the country they have attended. जो the Tata Memorial Centers के सभी doctors, just now the doctors have explained exactly what they are going to do in the future and what they have doing at present. मैं खास करके बात करूँगा at present गोवा गवर्नमेंट की तरफ से जो हमने इस रिसर्च के लिए जो हमारा टाइप टाटा मेमोरियल हॉस्पिटल फॉर द रिसर्च सेंटर के साथ हुआ इसके बारे में. Goa has taken the pioneering step in the integrated evidence-based Ayurveda with the modern oncology under the structure-led initiatives. This initiative has catalyzed through the high-level consultations beginning from the 11th of March 2025, making a decisive shift of the concept in the actions. We have formal collaborations between the Government of Goa, Directorate of the Health Services, AIA, All India Institute of the Ayurveda, and ACTREC, the Tata Memorial Center, TMC, Mumbai, in consultation with the empowered committee from the 16th of April 2025 to ensure the governance, accountability and in the phased executions. We have adopted the 5-year research vision with converging prevention, treatment, supervisorship and a long-term outcomes. We have emphasized this on the longitudinal cohort study which is been in jointly with the Tata Memorial Center, which is structured Ayush Allopathy Joint Clinic tumor board which established enabling the multidisciplinary evidence-based decision making for the cancer patient, ensuring the ethical integrations without any mixopathy. We had already established our OPD at our AIA center, which is by both the allopathic and Ayurveda at present, which is going on in the Ayush Hospital of Goa. We are focusing on the patient-centric supportive care, treatment planning and follow-up to improve the quality of the life and continuation of the care. It will be the dedicated knowledge and it is a collaboration center to be established under the special purpose vehicle which we call under the Swaympurna Goa program of the Government of Goa in collaboration with the ACTREC Tata Memorial Center. We are focusing on the scientifically designed research and clinical studies, particularly in adjuvant therapy and advanced cancer care. We are development of the collaborative cell for integrative oncology at AIA, the Goa with the definite timelines and in regular compliances. It will be the institutional ethics approval, clinical protocol integrations and structured governance mechanism will be in place. The state government is committed to spend 40 to 50 lakhs of rupees annually for continuously for the 5 years plan for the sustainability and the research oriented studies. We are establishing the Ayush Allopathy Tumor Board to ensure multidisciplinary, ethical and evidence-based driven care. It is a clear policy of stance against the mixopathy. Integration is based strictly on the science and structured protocols. It is an alignment with the national initiatives such as the Samakalan 2.0 It is an integrative approach of the Tata Cancer Integrative Goa is emerging as a national demonstration state for the integrative oncology aligned with the Ayushman Bharat and National Ayush missions. Design will be the replication across India, integration policy, research, clinical care, and for the digital innovations. So Goa is not merely is an integrated, but we are building the scientifically governed, digitally enabled, patient-centric model of the cancer care that can serve as the temple for the nations. So इसी तहत मैं बस इतना कहूँगा कि I am congratulating for the organizers of the Samakalan, this type of initiatives which is required, वो उन्होंने initiatives लिया है और integration में काम करने वाले पूरे देश के डॉक्टर्स को यहाँ बुलाया है. Not only that, the government of India has sanctioned for the Center of Excellence approximately the 300 crores of rupees for this Center of Excellence. ये Honorable Prime Minister नरेंद्र मोदी जी की बहुत बड़ी gift for the Ayurveda, big gift for the integration. I think मुझे लगता है कि the ancient science Ayurveda के ऊपर research करने का पहले छोटे मोटे research तो पहले भी हुए थे, लेकिन इस तरह का रिसर्च और इतने लेवल पे होना विच विल बी गिव द बहुत बड़ी गिफ्ट है. और इन लॉन्ग रन इट इज़ अ कैंसर ट्रीटमेंट विल बी द अफोर्डेबल एंड एसेसेबल टू ऑल, ये मैं कह सकता हूँ. और डेफिनेटली एंड इंडिया फॉर वी द रिसर्च एट प्रेजेंट भी एंड वर्ल्ड हेल्थ ऑर्गेनाइजेशन की तरफ से जामनगर में फॉर द ट्रेडिशनल मेडिसिन पे डिफरेंट रिसर्च इज गोइंग ऑन एट प्रेजेंट ऑल्सो, बट स्पेशली दिस सेंटर ऑफ एक्सीलेंस जो कैंसर रिसर्च में करेंगे, यहाँ के सभी पूरे टीम को मैं बहुत बहुत बधाई देता हूँ. और इनका रिसर्च यानी सक्सेसफुल रीति से जल्दी हम पेशेंट्स के लिए अफोर्डेबल हो, इसी बात पे मैं मेरी वाणी को विराम देता हूँ. थैंक यू. You want to ask anything?
First, introduce yourself so that people know. So you can honorable. Dr. Vikram Gota will give you. Sorry, I'm.
No. Of course. It is true.
So Dr. Vikram Gota will give you the full detail, not only one or two words, of all the research that is going on as a compilation. So there are multiple products. This is not only one. And since has time constraints, we discuss things which are more policy driven or something, and technical, of course, Vikram will give you. So Vikram, please spend time with her and give her this.
Center of Excellence will be set up, and it will be, and what will be its.
This Center of Excellence is called Integrative Center for Treatment Research and Education, which is a 300 crore capital project. Place called Khopoli, Moonmat Reservoir. The building will be ready in another 4 to 6 months. Full commissioning will take under 2-3 months. All of you are welcome to visit the facility maybe by September and October when the weather is also best in that area. So it is a 100-bedded hospital. But hospital nahi, that is an applied research facility for integrative oncology.
Yeah. Dr. Shekhar Sarkar is a cancer surgeon actually from the Goa.
And our alumni from
Yeah.
In Goa, we get around 1,500 to 1,600 new patients for a population of 15 to 16 lakhs. So it's around 100 per lakh of population, which is, I think, par with the other cities. Not villages. Villages, I think it is a 40 to 50. But the cities are around 100 to 110 to 120. But we are much better than USA. USA is 300 plus. But if we don't take care, I think we are heading towards USA. their best mean least cases are in cervical cancer, which is actually very high in all over India.
That's the difference between Goa and the rest of the country, that they have much less cervical cancer, but they have much higher colon cancer, which is not very high in other parts of India.
Okay, what is the reason?
That is because of our meat eating is population is very high. Red meat is population is very high, and it's almost, I would
The
say,
non-veg communities.
almost more than 50% of the population
More than
loves,
that. More
loves
than that.
meat. So not the fish, not the fish. It is red meat, like beef and all those things. We have around 30% Christian population, around 10 to 15%. Both of them are loving this thing. Plus Hindu population also love to eat mutton. So that, but we are also, it is less, not very high, but less than USA because of our spices, and we always have some vegetables, 1 or 2 vegetables with the meat, and not meat every day, but maybe once in a week or once in. Total beds we have around 5,000 total beds. We are the best in the, our model is best. We have 350 population ke liye 8 doctor. We may not get some plumbers, but we have sufficient doctors.
Sir, I'm Yogesh from Doordarshan. Sir, is it the first time?
At this level, it is the first time. But few of the doctors and few of the practitioners, they are doing by their own also. And earlier also there is a small support for the small institutions. But at this level, this is a big thing.
Why don't you talk about the National Center for
No, that is a NEMA organization.
maybe
I will just say about the tumor board. Tumor board is there. Is the first time I think happening, because we have now Tata Hospital doctors online coming. Aya doctor and Ayurvedic doctor sitting. We are also sitting together and deciding about the patient. This is happening first time I think.
So
That
joint
means
clinic,
Joint clinic.
wherein Ayurveda expert, allopathic experts sit together to decide what is best suitable for a given patient, is what is happening for the first time in India.
recently what happened is the Supreme Court we are seeing when Power Arm started wearing something on the loop as a same platform that is completely different. So TMC all.
It's a joint combined decision.
Yeah, what is it?
Tata Hospital doctors also are there. They are online now. First time they were in person. Now they are online. The patient is sitting there and we are discussing, and then we give them what is the best. We give them a type report. See,
So let me explain one thing. Today, if we were to see patients in India, the 5-year survival of all cancers put together is about 50%. That means in 50% of them we lose our patients. This is an effort to see newer medicines will come from the West, from the allopathic medicine. But is there anything that we can run research on to see whether Ayurvedic interventions can improve this outcome from 50% to 60% or 70%? If that can be achieved, then this will be the most affordable entity to be implemented, and in my opinion, a first step towards feeling that we have pride in what we have.
Away, and we realize that whether we like it or not, 100% of our patients, they do search YouTube or they Google for alternative medicine. 100% of the patient in their lifetime. They don't do it, their caregivers do it. So either we allow unregulated, unauthorized, unvalidated people to teach our patients, or we do scientifically in a research-based manner how it can be done. Not something only cultivation. There is a coming up almost 1 lakh square. That is constructed. And once it is constructed, traditional plants growing, another land is there, that is also simultaneously happening. So when I say commissioning, it is end of the project for construction of the dedicated research facility for integrative oncology. So the
Traditional medicine.
happening in Kharghar. We already have started. The buildings can come, but cancer can't wait. Started our integrative research, and Vikram will tell you. Goa, they have already started. CM Sahab has already pushed us to start the integrative oncology.
The last word for how the patient.
It is yet to come. We're talking about research.
Yeah. So he will tell you the technical details of all the projects.
That's why, doctor, you can give the technical details to them. Thank you. Thank you. Rolling. Yeah. बस थैंक यू चलो आप तुम्ही द्या
Bite देना है आपको. They want your bite.
बापरे.
Some message in Marathi. He will say.
मराठीमध्ये समकालीन इंटिग्रेटिव्ह अप्रोच अँड ट्रेडिशनल कॉम्प्लिमेंटरी अँड इंटिग्रेटिव्ह मेडिसिन्स 2.0 हा कार्यक्रम जो आयुष सेंटर ऑफ एक्सिलन्स ॲडव्हान्स सेंटर फॉर द ट्रीटमेंट रिसर्च अँड एड्युकेशन कॅन्सर टाटा मेमोरियल सेंटर आणि इन कोलॅबोरेशन विथ द सार्स सेंट्रल आयुर्वेदा रिसर्च इन्स्टिट्यूट मुंबई सपोर्टेड बाय द मिनिस्ट्री ऑफ आयुष गव्हर्नमेंट ऑफ इंडिया याने आयोजित केला होता. या कार्यक्रमाला जो रिसर्च स्टडी इन इंटिग्रेशन ऑफ द आयुर्वेदा ह्याच्यावरती ऑलरेडी सुरू आहे. त्याच्यावरती 3 दिवसाची चर्चा त्यांनी घडून आणली. त्याबद्दल सगळ्यांचं खूप खूप अभिनंदन. आणि इट इज वन ऑफ द बेस्ट इनिशिएटिव्स आणि सेंटर ऑफ एक्सिलन्स ज्यासाठी गव्हर्नमेंट ऑफ इंडियाकडून अप्रॉक्सिमेटली 300 crores ऑफ रुपीज टाटा मेमोरियल सेंटर ह्यांच्यासाठी दिलेले. आय थिंक इन अनादर एक 4 ते 5 महिन्यामध्ये सेंटर ऑफ एक्सिलन्स खोपोली या ठिकाणी जे सुरू होईल त्यासाठी खूप खूप शुभेच्छा. कॅन्सरची ट्रीटमेंट लोकांना अफोर्डेबल पद्धतीने व्हावी आणि इट इज अन रिसर्च बेस आणि इंटिग्रेशनसुद्धा जरी असेल म्हणजे ट्रेडिशनल मेडिसिन जरी यूज करायचं असेल तरी तो रिसर्च बेस असेल. आणि जेव्हा टाटासारखी इन्स्टिट्यूट त्यांच्याबरोबर रिसर्च बेसमध्ये काम करते डेफिनेटली पीपल विल बिलीव्ह फॉर दिस रिसर्च आणि ही ट्रीटमेंट लोकांना अफोर्डेबल व्हावी यासाठी आणि ॲक्सेसिबल पण असावी यासाठी टाटा मेमोरियल सेंटरचा रिसर्च आणि सेंटर ऑफ एक्सलन्स यासाठी खूप खूप शुभेच्छा. मी एकच सांगेन की आत्ताच्या घडीला की इंटिग्रेशन जो सुरू आहे ट्रीटमेंट म्हणजे आपण ज्याला म्हणतो की प्रिव्हेन्शन इज बेटर दॅन क्युअर हे आयुर्वेदामध्ये सदोदित म्हटलेलं आहे. डायरेक्टली एका शब्दात मी आयुर्वेदात बरा होतो हे म्हणण्यापेक्षा आयुर्वेदाच्या मेडिसिनचा रिसर्च तो या ठिकाणी सुरू आहे. खूप काही आपल्याला सांगू शकेल की त्याचमुळे म्हणजे आपण आयुर्वेदामध्ये स्वास्थ्यवृत्तम जे सांगितलेलं आहे कॅन्सर होऊ नये म्हणून कितीतरी उपाय जे सांगितलेले आहेत ते जरी केले तर कॅन्सर होणार पण नाही आहे. इट इज अन प्रिव्हेन्शन इट इज बेटर. ट्रीटमेंट झाल्यानंतर त्याची काय काळजी घ्यावी आणि मग त्याच्यानंतरच्या पुढे रिसर्च यासाठी हा रिसर्च सुरू आहे.
पर्यटकांची संख्या कमी झाली
गोव्यामध्ये पर्यटकाची संख्या कमी झालेली नाही आहे. फक्त इट इज अन सोशल मीडियावरती खूप मोठ्या प्रमाणात ते कमी झालेली आहे म्हणून दाखवतात. आजही गोव्यामध्ये गेले ते सगळे हॉटेल 80% फूड्स आपल्याला मिळेल आणि नाव वी आर प्रमोटिंग द वेलनेस टुरिझम इन द स्टेट ऑफ गोवा. समाकालन 2.0 इंटिग्रेटिव अप्रोच जो प्रोग्राम आयुष सेंटर ऑफ एक्सीलेंस एडवांस सेंटर ऑफ ट्रीटमेंट इन रिसर्च सेंटर ऑफ कैंसर टाटा मेमोरियल सेंटर और इन कोलैबोरेशन विद द सार्स एंड मिनिस्ट्री ऑफ आयुष ने यहाँ पे आयोजन किया है. इस 3 दिन के इस कार्यक्रम के लिए मैं उनको बहुत बहुत शुभेच्छा देता हूँ. टाटा मेमोरियल रिसर्च सेंटर के सभी डॉक्टर्स और इंटीग्रेशन ट्रेडिशनल आयुर्वेदा और बाकी के सभी डॉक्टर्स इस 3 दिन के सेमिनार में यहाँ पे रहे और इंटीग्रेशन पे जो चर्चा हुई इसके लिए मेरी बहुत बहुत शुभकामनाएं. मैं सबसे पहले द गवर्नमेंट ऑफ इंडिया की तरफ से यानी ऑनरेबल प्राइम मिनिस्टर नरेंद्र मोदी जी को बीइंग एज आयुर्वेदिक प्रैक्टिशनर मैं धन्यवाद देता हूँ क्योंकि सेंटर ऑफ एक्सीलेंस जो टाटा मेमोरियल सेंटर को दिया है मोर देन 300 crores ऑफ रुपीज़ ये सेंटर ऑफ एक्सीलेंस मुंबई खोपोली में एस्टैब्लिश जो हो रहा है इससे डेफिनेटली इंटीग्रेशन के ऊपर या आयुर्वेदिक मेडिसिन के ऊपर रिसर्च होगा विच इज़ द रिसर्च बेस्ड मेडिसिन लोगों को मिलेगी. इसलिए भी मैं उनका धन्यवाद देता हूँ. गोवा में इस तरह से जो ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा सेंटर अय्या जो एस्टैब्लिश हुआ वहाँ पे हमने ऑलरेडी इंटीग्रेटेड ओपीडी ऑलरेडी हमने स्टार्ट कर चुके हैं अलॉन्ग विद द टाटा. वी आर डूइंग नाउ द ऑल्सो देयर इज अ टाई अप विद द गोवा मेडिकल कॉलेज. कोहोर्ट स्टडी जो गोवा गवर्नमेंट ने ऑलरेडी स्टार्ट किया विद द टाटा मेडिकल रिसर्च सेंटर वो कोहोर्ट स्टडी इज अप्रॉक्सीमेटली ऑन द 1 लाख ऑफ द पीपल, उनके ऊपर जो स्टडी होगा डेट विल ऑल्सो द यूजफुल फॉर द फर्दर रिसर्च। इसीलिए पूरे देश में जिस तरह से ऑनरेबल प्राइम मिनिस्टर नरेंद्र मोदी जी के लीडरशिप के अंतर्गत जो पूरे रिसर्च बेस्ड जो ट्रीटमेंट यानी आयुर्वेदा में और बाकी इसमें जो स्टार्ट हो रहे विच विल इज द कैंसर पेशेंट्स के लिए इट इज़ एन एफोर्डेबल और एसेसिबल ट्रीटमेंट बाकी सभी लोगों के लिए मिल जाएगी। डेट्स ऑल, थैंक यू।